my name is Stephanie Battelle. I'm going to be doing my final video assessment. This is Michelle Morgan. She's going to be my patient. I'm going to start off by washing my hands. And I'm going to do a general survey of just the level of consciousness, look for signs of distress, personal hygiene, grooming, and everything like that. Ask her if she's alert, the date. What is the date?
Today is Thursday, December 6th.
December 6th. Okay, and what's the year?
2012.
What's your name?
Michelle Morgan.
Do you know where you're at?
Yes, I'm at Cardeen's house.
Do you know what my name is?
Stephanie Battelle.
Okay, so the patient seems to be alert and orientated. I'm going to check out the skins and nails. I'm just going to add these to my pocket. I'm just going to overall kind of look. I can't really see her legs, but if this patient and they had their gown on, I would be able to assess more of her back and the skin areas. I'm going to palpate the moisture of her skin, temperature, skin turgor. Also the back, we'll just pretend that I'm actually on the bare skin. So, and I would have her, if she was lying down, I would have her roll over to, look at the bottom area and everything like that. Okay, and then I'm going to inspect her skull. So do like the head and the neck. I'm going to inspect and palpate the hair and the scalp. Sorry, I'm going to take out your headband, Michelle. So, scalp. I'm feeling for any abnormalities, facial features. And I'm going to palpate facial bones, the sinuses, and everything else. Okay. Now I'm going to test for the cranial nerve number 5 and do the trigeminal. I put my little soft and hard sensation in my pocket. So we're going to do the sensation of the face, of the head, cheek, and nose. Or the head, cheek, and chin, I'm sorry. Okay, can you tell me? You're going to come up and get close so you can see the soft and hard. Okay, go ahead.
Soft.
Okay, let's do this again. That's soft, that's hard. Now here we go. Ready?
Poke. Soft. Poke. Soft.
Okay, you want to bite your teeth. And I'm just testing for the muscle strength. Can you clench them?
Mm-hmm.
Okay, and then let's go on to the cranial nerve number 8. I'm going to have you puff out your cheeks, smile, frown. Alright, looks good. Can you wrinkle your forehead? And I'm just looking to make sure that she can do all of this. Close eyes tightly. Show your teeth again. Okay, I'm going to inspect the eyebrows and the eyelids. Basically, I'm looking for symmetry here. And I'm going to check. Can you shut your eyes? Sorry, I'm going to stay in the light. I'm just assessing the eyelids, upper and, sorry, we open them, and lower. And I'm going to assess the iris and the, I can never say it, the conjunctiva. Okay, and we're going to move on to the corneal light reflex. So we'll just, this light is going to blind her. This probably isn't the best one, but we would just be looking to make sure that everything is equal, reactive, and have her look to side to side, side to side. Okay, and then they were all equal, round, reactive. And I'm going to also do the peripheral visual field, which is test the cranial nerve 2. Yes, sorry. Okay, here we go. And then, like that. You want to get up close so we can see the see her finger. And we would be using an otoscope too for some of these when we go into the ears. So I'm going to get in here and see her ears. We're going to inspect the ears, the tissues, The auricle is the mastoid. Okay. And here. And then we're going to go move on to cranial nerve number 8. And I'm going to do the hearing whisper test, okay? So, what did I say?
You said your name is Stephanie.
Okay, great. And then if you're going to come around, we're going to do the nose. So, we'll just use this light. We inspect the nose, the nasal pathway. And everything looks good. The septum and the terminals. Good. Okay. And also, closer. I'm going to have you open your mouth. And here we go. Okay, I'm inspecting the mouth. Put your tongue out, please. Lips, teeth, gum, oral mucosa. If I had gloves on, I would actually put my fingers in there and check it. And can you stick your tongue out and make sure that uvula is midline? I can't see it go, There we go. Okay, and then I'm going to move on to the cranial nerve 9 and 10. The gag reflex, again, I would be actually using a tongue depressor. I'm like, to stick in the back and actually have some type of gag reflex. And then I'm going to have her protrude her tongue from side to side. Sorry, I'm just adding light. And that's cranial nerve number 12. Okay. And then we will move on and do, let me go put my flashlight down. Okay, we're going to move on to then the neck. So here, if you just want to look, we're going to inspect it from just any masses or scars and palpate all the lymph nodes, the pre, post, occipital, submaxillary. And we'll just feel around. I'll check the carotid arteries around here. Which is them? Now feeling the collarbone for the lymph nodes. Okay, and now we're going to do some upper extremity musculoskeletal movement. We did this one not too long ago, so if you remember from the videos, I'm going to have you first just put your arms, abduction, adduction. Just kind of do a general circle. Put your arms behind your head, and then back around this way. Okay, and then, sorry, I'll move out of the way. And then I'll have you press against my hands, like try to, there we go. Then again, out. And then fingers straight out, don't let me close them. I'm going to get down. Okay. Alright, and then I'm going to stay with the upper shoulders. You want to shrug them and show that you can do that. Okay, and we'll keep moving, sorry. Also feel the pulses. And I'm going to palpate the shoulders, make sure that they're even. Brachial pulse. And palpate the elbows. And again, check the radial pulses. And inspect the fingers. And have you go like this with your wrist. and then down, and then up. Okay. And we'll go on to the lungs and thorax. So I'm going to first just start out by palpating posteriorly if you want to come around and get on this. Okay. And while I'm doing this, I'm also measuring the rhythm and pattern of her respirations. And I'm going to then percuss. Lung fields. And I'm going to auscultate as well. And then I would be under her shirt. Okay, and then I want to come around to the front and we'll do the front. We'll do anterior. Do you want to come around? We'll do anterior. And we'll do the same thing. And when we get close, we're just going to kind of palpate. And we'll percuss. I'm not going to go into much more over here. And we'll listen. And then start up high. Okay. And that'll complete that part, and part 2 will come up next.